Hello, friends. Today we are going to discuss basic course on mental health diseases, part 3. In this course, we will discuss the personality disorders, in which borderline personality disorders called BPD will be discussed. These are the disorders like distorted self-image, mood swings, unstable relationships between individuals, fear of abandonment, impulsive behavior, self-injury, risky behavior to others as well as to oneself, feeling of emptiness, suicidal threats, self-control, mental therapist, inappropriate anger, and suspicious nature. All these are in this borderline personality disorders. Definition. Borderline personality disorder, BPT, is a mental health disorder characterized by a pervasive pattern of instability in interpersonal relationships, self-image, emotions, and impulsivity. Individuals with BPD often experience intense and unstable emotions and may engage in impulsive and self-destructive behaviors. This is a strained relations example. Symptoms of BPD. Symptoms of BPD can vary widely among individuals, but typically include fear of abandonment, intense fear of being abandoned or rejected, which can lead to frantic efforts to avoid real or imagined abandonment. Unstable relationships. Intense and unstable relationships, swinging between idealization and devaluation of others. Unstable self-image, distorted and unstable self-image or sense of self, often leading to sudden changes in goals, values, opinions, and career choices. Impulsive behavior. Impulsive and often risky behaviors such as substance abuse, reckless driving, binge eating, or self-harm to oneself. Emotional instability. Intense and rapidly changing emotions, including irritability, anxiety, and depression, which can lead from a few hours to a few days even. This is a oppositional defiant disorder in children. Symptoms of BPT include chronic feelings of emptiness and boredom, often leading to efforts to fill the void with intense, often unhealthy activities or relationships. Explosive anger, difficulty controlling anger, leading to frequent displays of temper, constant anger, or recurrent physical fights between them. Dissociation, feeling disconnected from oneself even, or thoughts, feelings, or surroundings, maybe from anything. paranoia, or severe dissociative symptoms. Transient stress-related paranoid ideation or severe dissociative symptoms. This is one of the examples. Causes. The exact cause of BPT is not known, but it is believed to be a combination of genetic, environmental, and neurological factors. Genetics. BPT may be inherited or influenced by genetic factors, as it often runs in families. Brain abnormalities. Differences in brain structure and function, particularly in areas of related to emotion, regulation, and impulsivity, may play a role. Environmental factors. Traumatic events such as abuse, neglect, or unstable relationship in childhood may increase the risk of developing BPD, called ACEs. Neurological factors. Imbalances in neurotransmitters such as serotonin, which regulates mood, may contribute to BPD symptoms. Diagnosis of BPD. Diagnosis of BPD is based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. To be diagnosed with BPD, an individual must exhibit a pervasive pattern of instability in interpersonal relationships, self-image, and affects, as well as impulsivity, imagining by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. Frantic efforts to avoid real or imagined abandonment. A pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. Identity disturbance. Markedly and persistently unstable self-image or sense of self. Impulsivity is at least 2 areas that are potentially self-damaging, that is spending too much, sex, substance abuse, reckless driving, binge eating. Recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. Affecting instability due to a marked reactivity of mood, that is intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. Chronic feelings of emptiness, inappropriate intense anger or difficulty controlling anger, frequent display of temper, constant anger, recurrent physical fights, transient stress-related or paranoid ideation, or severe dissociative symptoms. Treatment for BPD. Treatment for BPD often involves a combination of psychotherapy, medication, and support services. Dialectical behavior therapy, a type of psychotherapy that focuses on teaching individuals skills to manage emotions, control destructive behavior, and improve relationships. Cognitive behavioral therapy, CBT, helps individuals identify and change negative thought pattern and behavior. Medications, antidepressants, mood stabilizers, and antipsychotic medications may be used to treat specific symptoms of BPD, such as depression, mood swings, and impulsivity. Supportive services, case management, group therapy, and peer support can help individuals with BPD manage their symptoms and improve their quality of life. Prognosis and summary. The prognosis of BPT varies widely depending on the individuals and levels of support and treatment received. With proper treatment, many individuals with BPD can learn to manage their symptoms and lead a fulfilling life. However, BPD is a chronic condition and long-term treatment may be necessary for maintain stability. Summary. Borderline personality disorder is a complex mental health disorder characterized by instability in interpersonal relationship, self-image, emotions, and impulsive behavior. Understanding for its symptoms, causes, and treatment options is essential for providing effective support and care for individuals with BPD. Number 2 is antisocial personality disorder. Asocial and antisocial, there is a difference. Asocial prefers not to be social. Antisocial, reckless disregard for the rights of others. Antisocial personality disorder definition is a mental health disorder characterized by a pattern of disregard for and violation of the rights of others. Individuals with ASPD often engage in behaviors that are manipulative, deceitful, and in violation of social norms, rules, and laws. They may have a pervasive pattern of irresponsibility and lack of remorse for their actions for others. Symptoms of ASPD. Symptoms of ASPD can vary widely among individuals, but typically include disregard for laws and social norms, deceitfulness, repeating lying, use of aliases or conning others for personal profit or pleasure, impulsivity, failure to plan ahead or impulsivity, irritability and aggression, reckless disregard for safety for others, consistent irresponsibility, failure to sustain consistent work behavior, lack of remorse or indifference to the hurt, mistreatment, or theft they have caused to others. Antisocial personality disorder symptoms in a nutshell: repeated law-breaking behaviors, deceitfulness, impulsivity, irritability, aggressiveness, often with repeated fights, assaults, reckless disregard for own other safety, irresponsibility, and failure to meet basic obligations, lack of remorse. ASPD can't be diagnosed before age 18. Causes of ASPD. The exact cause of ASPD is not known, but it is believed to be a combination of genetic, environmental, and neurological factors as before. Genetics may be inherited or influenced by genetic factors. Environmental factors, childhood trauma, abuse, neglect, or increase the risk of developing ASPD. Neurological factors, differences in brain structure and function, particularly in areas related to impulse control and empathy, may play a role. Diagnosis. Diagnosis of ASPD is based on DSM-5. To be diagnosed with ASPD individual must be at least 18 years old and exhibit a pervasive pattern of disregard for and violation of the rights of others, as indicated by three or more of the following: failure to conform to social norms with respect to lawful behaviors, as indicated by repeatedly performing acts that are grounds for arrest; deceitfulness, as indicated by repeated lying, use of aliases or conning other others for personal profit or pleasure; impulsivity or failure to plan ahead; irritability and aggressiveness, as indicated by repeated physical fights or assaults; reckless disregard for safety of self or others; consistent irresponsibility, as indicated by repeated failures to sustain consistent work behavior or honor financial obligations; lack of remorse, as indicated by being indifferent to or rationalizing having hurt, mistreated, or stolen from another. Treatment for ASPD. Treatment for ASPD is challenging, as individuals with this disorder often do not see their behavior as problematic and may resist treatment. However, psychotherapy and sometimes medications can be helpful. Psychotherapy in the way of CBT or group therapy can help individuals. Medications, there are no medications specifically approved to treat ASPD. Supportive services, case management, and vocational rehabilitation can help individuals with ASPD manage their symptoms and improve their functioning in society. Prognosis and summary. The prognosis for ASPD is often poor, as individuals with this disorder may be at increased risk for engaging in criminal behavior, substance abuse, and other harmful activities. However, with appropriate treatment and support, some individuals with ASPD can learn to manage their symptoms and lead more stable lives. Summary: antisocial personality disorder is a mental health disorder characterized by a pattern of disregard for and violation of the rights of others. Understanding its symptoms, causes, and treatment options is crucial for providing effective support and care for individuals with ASPD. Eating disorders. Anorexia nervosa. In eating disorders, there are three main: anorexia nervosa, bulimia nervosa, and binge eating. Definition of anorexia nervosa is a serious mental health disorder characterized by an intense fear of gaining weight and distorted body image. People with anorexia may go to extreme lengths to control their weight and shape, often through restrictive eating, excessive exercise, or other weight control behaviors. Despite being underweight, individuals with anorexia may see themselves as overweight. Eating disorders awareness week. Eating disorders are not a girl thing, a ploy for attention, just a phase, only about food, visible, a choice about being skinny. Symptoms of anorexia nervosa. Symptoms: restricted food intake, severely limiting the amount of food eaten, often leading to significant weight loss; intense fear of gaining weight. Despite being underweight, individuals with anorexia may fear gaining weight or becoming fat. Distorted body image, seeing oneself as overweight even when underweight. Preoccupation with food, dieting, and body image, spending a lot of time thinking about food, dieting, and body shape. Denial of the severity of low body weight. Some individuals may not recognize or admit the seriousness of their low body weight. Physical symptoms. Physical signs of anorexia may include extreme weight loss, fatigue, dizziness, fainting, thinning hair, dry skin, and brittle nails due to malnutrition. Emotional and behavioral changes. Individuals with anorexia may become irritable, withdrawn, or depressed. They may also engage in rituals around food, such as cutting food into tiny pieces or eating very, very slowly. Cause of anorexia nervosa. The exact cause of anorexia nervosa is not known, but it is believed to be a combination of same genetic, biological, environmental, and psychological factors. Diagnosis of anorexia nervosa. Diagnosis of anorexia nervosa is based on criteria DSM-5. To be diagnosed with anorexia nervosa, an individual must exhibit restriction of energy intake relative to requirements, leading to a significant low body weight in the context of age, sex, developmental trajectory, and physical health. Intense fear of gaining weight or becoming fat, even though underweight. Disturbance in the way in which one's body weight or shape is experienced under influence of body weight or shape on self-evaluation or denial of the seriousness of the current low body weight. Treatment for anorexia nervosa. Treatment for anorexia nervosa often involve a combination of therapies, including nutritional counseling, working with a dietitian to establish healthy eating patterns and weight gain, psychotherapy, individual, family, or group therapy can help address underlying psychological issues and improve coping strategies. Medical monitoring, regular medical checkups to monitor physical health and address any complication of anorexia, such as electrolyte imbalance or heart problems. Medications, in some cases, antidepressants or other medications may be prescribed to treat co-occurring conditions such as depression or anxiety. Prognosis and summary. The prognosis for anorexia nervosa varies depending on the individual and the severity of the disorder. With early intervention and appropriate treatment, many individuals with anorexia can recover and maintain a healthy weight. However, recovery can be challenging and relapse is common. Summary. Anorexia nervosa is a serious mental health disorder characterized by an intense fear of gaining weight, a distorted image, and extreme weight loss. Understanding its symptoms, causes, and treatment options is crucial for providing effective support and care for individuals with anorexia. Eating disorder number 2, bulimia nervosa. In this disorder definition is a serious mental health disorder characterized by recurrent episodes of binge eating followed by compensatory behavior to prevent weight gain, such as self-induced vomiting, excessive exercise, or misuse of laxatives, diuretics, or even enemas. Like anorexia nervosa, bulimia involves a distorted body image and an intense fear of gaining weight. Symptoms: binge eating, eating large amounts of food in a short period of time, often feeling a lack of control over eating during the episode. Compensatory behavior: engaging in behavior to prevent weight gain, such as self-induced vomiting, misuse of laxative, diuretics or enemas, fasting or excessive exercise. Body image disturbance, a distorted body image and intense fear of gaining weight or becoming fat, despite being of normal weight or even underweight. Physical symptoms, physical signs of bulimia may include swollen salivary glands, dental problems, gastrointestinal issues, and electrolyte imbalances. Emotional and behavioral changes. Individuals with bulimia may experience guilt, shame, or disgust about their binge eating episode and may try to hide their behavior from others. Cause of bulimia nervosa. The exact cause nervosa is not known, but it is believed to be a combination of same genetic, biological, environmental, and psychological factors. Diagnosis of bulimia nervosa. Diagnosis of bulimia nervosa is based on criteria outlined in the Diagnostic and Statistical Manual Mental Disorder DSM-5. Recurrent episodes of binge eating characterized by both of the following: eating in a discrete period of time, that is within any 2-hour period, an amount of food that is definitely large than what most individual would eat in a similar period of time under similar circumstances. A sense of lack of control over eating during the episode, a feeling of that one cannot stop eating or control what or low much one is eating and how much one is eating. Recurrent inappropriate compensatory behavior to prevent weight gain and as self-induced vomiting, misuse of laxative, diuretic, enemas, or other medications, fasting is, or excessive exercise may be there. Treatment in the form of nutritional counseling, psychotherapy, medical monitoring, regular medical checkups, monitoring health, and address any complication of bulimia. Medication include antidepressants may be prescribed. Prognosis for bulimia nervosa varies depending on individuals and the severity of the disorders. Summary: bulimia nervosa is a serious mental health disorders characterized by recurrent episodes of binge eating, followed by compensatory behaviors to prevent weight gain. Obsessive compulsive disorder, OCD. OCD definition: obsessive compulsive disorder is a mental health disorder characterized by recurrent unwanted thoughts, that is obsessions, and or repetitive behavior, that is compulsions. These obsessions and compulsions can significantly interfere with daily activities and cause distress. An overview of OCD. These are all symptoms of OCD. Obsession: persistent, intrusive, and unwanted thoughts, images, or urges that cause distress or anxiety. Common obsessions include fear of contamination, fear of harming oneself or others, or a need for symmetry or exactness. Perfectionism: compulsions, repetitive behavior, or mental acts that an individual feels driven to perform in response to an obsession or according to rigid rules. These compulsions are aimed at reducing distress or preventing a feared event. Common compulsions include excessive cleaning or hand washing, checking, counting, or repeating actions. Impact on daily life. OCD symptoms can significantly interfere with daily activities, work, school, or relationships. Insight. In some individuals with OCD may recognize that their obsessions and compulsions are rational, while others may not. Types of OCD: contamination, perfectionism, checking, harm, separatism, religious or moral, sexual orientation, relationship. In all these fields, one may have OCD. Cause of OCD. The exact cause of OCD is not known, but it is believed to involve a combination of the same genetic, biological, environmental, and psychological factors. Diagnosis. Again, DSM-5 is on your rescue. The presence of obsession, compulsions, or both. The obsession or compulsions are time consuming, take more than 1 hour per day, or cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. These symptoms are not attributable to the physiological effect of a substance on another medical condition. Treatment of OCD often involves a combination of therapies, including cognitive behavioral therapy, ERP, involves gradually exposing the individual to the source of their obsession and preventing them from engaging in the compulsive behavior. Medications, selective serotonin reuptake inhibitors, SSRIs, are often prescribed to help reduce the symptoms of OCD. Other therapies such as acceptance and commitment therapy or dialectical behavior therapy may also be beneficial in treating OCD. Participating in sport groups with others who have OCD can provide additional support and encouragement. Prognosis. Prognosis for OCD varies, but with the proper treatment, many individuals with OCD can experience significant improvement in their symptoms and quality of life. However, OCD is a chronic condition and ongoing treatment may be necessary to manage symptoms effectively. Summary: OCD is a mental disorder health characterized by recurrent unwanted thoughts and or repetitive behavior. Understanding its symptoms, causes, and treatment options is crucial for providing effective support and care for individuals with OCD. Thank you very much. That's all.